Well, we're talking today about the circumcision decision. If you are pregnant and you have discovered it's a boy, congratulations, and then you have to deal with this decision. Are you going to get your son circumcised or not? Circumcision was a most routine and continues to be a very routine procedure, especially in the United States. However, sentiment has been developing against the circumcision procedure in the last 20 to 30 years, and the circumcision rate in the U.S. is down to about 60%. Our guest who will help us and help you make the decision are with us in the studio. Shelton Walden is the director of the New York chapter of No Circ, as well as the No Circ liaison to the United Nations. We will explain what No Circ is. He's also host of the radio show Walden's Pond on WBAI in New York. And next to Shelton, Dr. Robert Kirsch is a Moyle for the Messianic Jewish community, as well as the section head of interventional radiology at Roxborough Memorial Hospital. Gentlemen, thank you both for being with us. And first off, for our viewers who don't know, what is No Circ?
No Circ is the National Organization of Circumcision Information Resource Centers, an organization that was founded back in 1989 by, co-founded by a former nurse named Marilyn Milos, who was upset by the circumcision she saw as a nurse in hospitals where she worked in Marin County, California. And she started this organization around that time, and since then it's blossomed into an international organization which dozens of chapters around the world has hosted several international symposiums on circumcision and genital integrity. The most recent one was held in Sydney, Australia in December. And its organization is an educational, nonprofit educational organization designed to
teach parents,
and
to
help
the option.
Exactly, that they can see the other side, and to give them information that they would not normally get or have not normally received, particularly in the last 50 years. In American hospitals.
Okay, Dr. Kirsch. Now, of course, the American Academy of Pediatrics came out maybe
their non-position.
Well, with their non-position about a year to 2 years back.
About a year ago.
What do you tell folks? Obviously, it is part of Jewish tradition to have your child. Yeah. So,
in Genesis 17, the covenant which establishes the people of Israel is based or is signified by circumcision on the 8th day. And it goes, that's in verse 10, and in verse 14 it says, the scripture goes so far as to say that a child who's not circumcised is cut off from the people of Israel. So circumcision is commanded for Jews by God, and there's, in my opinion, no way of getting around it. Mm-hmm. For non-Jews, it's a different story altogether. For non-Jews, circumcision is optional. There are medical reasons, pro and con, which I think the American Academy of Pediatrics paper reflects, that the arguments in either direction are not particularly strong. That, yes, it's a surgical procedure, it has a relatively low complication risk, and yes, it has some medical benefits which are not that strong. They prevent, circumcision may prevent some very rare disease, very rare, not rare, but diseases which have very low occurrence rates. Right. And that it largely remains for non-Jews a cultural issue, and it's up for grabs to some extent in our culture. For non-Jews, it's different. For non-Jews, it's very different than it is for Jews. For Jews, it's an obligation.
Mm-hmm. Okay, a religious obligation. Shelton, why did you join No Circ?
Well, back in 1995, as you mentioned, I host a regular radio program, and I contacted Marilyn Milos of No Circ to discuss this issue. And after doing a program with her, the way she described what happens to babies in hospitals and the fact that how they're strapped down and this vital part of their anatomy is taken from them, had a profound effect on me. And subsequently, I sent for information, and I got involved with the organization, and I started doing programs and educating myself and other people about this issue. And I felt, frankly, that there's been a lot of knowledge that has not been shared with people about this very important part of the body. And generally speaking, I think the American public is not fully educated about the body, and particularly about the penis and about its functions. And I think what NOCIRC has done is to educate and re-educate particularly lay people and also doctors and the medical establishment, the fact that the foreskin is a vital body part and should not be removed unless the person is of age as an adult. They want to remove it for themselves. They can do so.
So that one of NOCIRC's positions is that you have to have informed consent of the patient, and you can't have informed consent from a baby.
Absolutely not. To circumcise millions of boys to prevent 1 or 2 cases of phimosis seems to be a bit much. And the fact of the matter is, this is a medically unnecessary procedure. And we should be looking at this procedure less as a surgical procedure. The doctor should be looking at this as a detective. They can do non-surgical means of treating all kinds of inflammation and phimosis instead of resorting to surgery without anesthesia for the most part, and which causes pain, and also, frankly, it puts the infant at risk of amputation and serious damage to the penis.
Okay. On that note, we're going to be gone, but not forever. We'll be back in 2 minutes. Are you worried, viewers, about the medical implications of circumcision? Give us a call. We'll be right back. We're going to go to the phones. We have Samantha on the line with us. How are you?
Hi, I'm fine, thank you. My question's for the panelists. I was wondering what their opinion was about female circumcisions, which were primarily done in Muslim countries in Africa, but have since moved to the United States.
Yeah,
yes.
I'm totally against female circumcision. There is a law, there's a federal law in this country against female circumcision, and there's a New York State law against it, and in several states there's a law against female circumcision. It is clearly a barbarous act, and frankly, those of us who are against male circumcision feel the same way about male circumcision.
Yeah, right.
And I also want to say that there's activities going on in Canada right now, which are attempting to try to stop the law against female circumcision and say, look, it's discriminatory against men. You cannot have a law that says against female circumcision and then say, well, male circumcision is acceptable.